Switching gears to your health news, it's time for our weekly partnership with Asante.
This week, Asante's health expert, Beth Coker, talks with Dr. Kyle Rutledge about the warning signs and risk factors of teen suicide.
The teen years are a stressful time and they're filled with major changes. Sadly, suicide is the third leading cause of death in young people ages 15 to 24. Dr. Rutledge, what are the risk factors for teen suicide?
Biggest modifiable risk factor, the one a parent can control, is firearms in the home. If there's one thing I can convince everyone to do in our short amount of time, it would be limit access to firearms. If you can't get them out of the home, make sure they're locked up and inaccessible from your teen. That can save their life. Another risk factor is exposure to suicide. That can be just through media or watching shows where it's a major theme, but it's particularly true when it happens in the community. For instance, when a classmate attempts or completes suicide, the likelihood of another attempt at that school goes way up. Other big ones include family history of suicide and substance use.
What are some warning signs that a teen might be suicidal?
So it is impossible to completely predict, but there are some things to watch out for. One warning sign is social withdrawal. This seems especially true in kids who are usually really outgoing and friendly, who suddenly are isolating from peers at school or spending more time hiding away in their bedrooms at home. Another is a loss of interest in things they usually like. This could be hobbies or sports, or even a drastic decline in academic performance. Other warning signs are when kids seem more down and sad or much more irritable than usual. Finally, them making statements about not wanting to be alive anymore. This could be direct, but it could also be in their jokes, messages they write, or they can come through in any artistic expression.
And finally, what should a person do if they suspect a teen is suicidal?
Reach out to them. You don't have to be a professional. Support from family and friends goes so far. Let them know you're thinking about them, ask to spend time with them, and do something fun that they usually like to do. Make sure they know you care. And you can also reach out to their school to get more supportive people involved. If they're in your house and they've attempted suicide before, lock up whatever they used previously. And if you suspect a teen is suicidal, be direct. If you're concerned, you can ask if they're thinking of ending their life. Asking the question isn't going to increase their risk of suicide. You can also share the crisis number. The phone number to remember is 988. This routes you to the local crisis team who are ready to help. They can also text the word home to 741-741. And if you forget these numbers, if you just Google the word suicide, these numbers automatically come up for you.
Thank you so much for this very important information.